my goodness, I cut my hand. I need 911. No, Cam, you don't need 911 for a minor cut like that. We all have accidents sometimes, but it's how we react and recover that matters. Who knows what the first thing you should do when you get a cut is? It's okay if you don't know how to answer that question. In this video, we're going to walk you through the steps of healing a wound and the science behind it. Once you have watched this, you will be an expert just like us and remain calm and collected in these type of situations. The first thing you should do immediately is wash your hands. Now we'll show you a video with Stephen Blaha from the Cleveland Clinic. Give us a brief description of what you do at the Cleveland Clinic.
So I'm one of the staff physicians working in the emergency department at the main campus of the Cleveland Clinic, and we treat patients who present with acute injuries or illnesses and work to stabilize them.
Why is it important to wash your hands as soon as you get a cut?
So bacteria live all over our skin, and as soon as there's a break in it from a laceration or an abrasion, it can allow that bacteria to get in, and the sooner that you clean it out, the less likely it is to become infected. There are more contaminated wounds from like dirt, rusty objects that have a higher degree of getting infected, so those are especially important to perform cleansing.
What soaps should people stay away from?
So certain soaps contain like more fragrances, which can have harmful effects, as well as chemicals called parabens, which are used as preservatives in the soap, and there's other ones that increase like the foaming action, and those may contain chemicals which can also be harmful to use. So it's probably best to find soaps that have the least amount of these type of chemicals and are more natural.
What soap does the Cleveland Clinic use and recommend?
So we use Purell in both our hand sanitizers and hand soaps. I'm not going to say that I would recommend a particular kind, although ones that have antibacterial properties would be best to use.
The next step you should take is to apply antibacterial ointment. We will be using Neosporin. According to Science Direct Journal, some evidence indicates that the rate of infectious complications decreases when a broad-spectrum topical antibiotic ointment is applied to the cut-down site. Morton and colleagues found an infectious complication rate of 18% when using polymyxin B-neomycin bactrician, which is Neosporin, was used as opposed to a 78% rate in a placebo-treated group. We will now jump back to Steve Blaha explaining Neosporin. What ingredients in Neosporin help to heal open wounds and how?
So Neosporin is also known as triple antibiotic ointment because it contains 3 different antibiotics. These are bacitracin, polymyxin, and neomycin. They have antibacterial effects which help to prevent infection of a wound and allow healing.
If you don't use Neosporin after accidents, what could happen?
So there's an increased likelihood of infection because our skin is covered with bacterial flora, including staphylococcal species, also known as staph. So it would decrease the likelihood of the wound becoming infected.
How does the body react to application of Neosporin?
Typically, there shouldn't be a reaction to Neosporin, although there's an association with one of the 3 ingredients, neomycin, where it can cause a localized allergic reaction called contact dermatitis. for this reason, sometimes this is not used, and we only use either bacitracin by itself or bacitracin and polymyxin instead.
In the hospital, what instances would a trained professional use Neosporin on a patient?
So if a patient presents with an open wound, such as a laceration that we end up repairing with sutures or abrasion, we would typically apply Neosporin to it in order to prevent wound infection.
The last step in this process is to apply a Band-Aid. Band-Aids prevent dirt, oil, and other things from getting into your open wound.
Am I now protected from infectious diseases?
Well, Kim, your risk of infection has now significantly decreased. Be sure to reapply Neosporin and a Band-Aid about 3 times a day. Now you're good to go.